Hi, my name is Leslie, and I am just 1 year over having had a double jaw joint replacement surgery. When I first found out I needed the surgery, I didn't even know what the surgery was. So, after meeting with my doctor the very first time, I went home and started looking online. And ultimately, I found my way over to YouTube where I discovered other people's stories of like the surgery and the recovery and just overall their progress. And I found that incredibly comforting. And I felt like as a collective, once I watched all these videos, I felt like I had a better idea of what I was getting myself into. So this is me trying to pay it forward. And this video is basically my recovery pictures. I didn't take photos every day, and some of them were really embarrassing and very vulnerable, but this is 100% from a place of hoping to be helpful to other people. And I will give context where it is necessary. I'm going to try to narrate this, but one of the things that you will notice after my surgery is that I did have facial weakness and facial paralysis, and so my face could not move. And some of it I regained, and some of it I've not gotten back at all. I cannot move this eyebrow up and down, and I didn't have control of my ocular muscles, and so I struggled to blink. My eyes did some weird Bell's palsy shifty thing, and I just basically had a very dead-looking face with no expression. And then, as I speak right now, I still notice the fact that my mouth does still pull to the right because I don't have full strength of this lip yet. But anyways, so these are the photos of my recovery, and towards the end of the full year mark, there are less and less photos because honestly, I got to the point that I forgot I'd had the surgery. But I know that in the very beginning, I was pretty discouraged about how I looked, even though I knew I was going to look bad. So it was comforting to see that other people did eventually look normal again. And yeah, all right.
I've included this video so that you could see my face just before my surgery. And my face is now both wider and fuller than it was prior to surgery. Initially, I thought it was due to swelling. Obviously, then I considered body weight, but I'm at the same body weight now than I was prior to surgery. So ultimately, my conclusion has become that the artificial jaw joints have widened my face, just giving me a structurally wider face, but I cannot make sense of how it is fuller now than before, but it is my new face.
A couple of hours before the surgery, I was just excited to have the surgery, not fully realizing what I was about to get into. But then about 8, 9 hours later, the mystery was gone. And I look at this photo and I just remember being really high and in pain and miserable. The next morning, the doctor came and removed my surgical bandages, and then I was able to really see the extent of my incisions and already had my first bruising appear. A couple hours after lunch, my doctor informed me that because my pain was managed to a 7 out of 10 with oral medication, I was cleared to go home if I wanted to, and I made the decision to go home because I was convinced I would be miserable whether I was at hospital or at home. But my husband had not slept for almost 2 nights, and since I needed him in top shape to help take care of me, I felt like it was in both our best interests to make the 2.5 hour drive home. And ultimately, it was the best decision for both of us. I ended up being very grateful for being able to take a shower at my house and put on my pajamas and get into my own bed and not get woken up by nurses and having to eat hospital food.
The drive is uneventful, but you can already see in this video some weird things are happening with my eyes. I got home, took a shower, and started experimenting with some of the things I had bought prior to surgery for recovery. Day 3 was predicted to be the worst day of swelling, and it lived up to its name. In fact, one of my teenage clients asked to see a photo of that day, and I showed it to him. And he just really confirmed what I had already suspected about myself, saying that I looked like a hippopotamus. So while I appreciate his honesty, it was both validating and horrifying. I made this video on day 3 while super high on drugs and then sent it to my colleagues and my sister. This is a permanent reminder that although I didn't spend thousands of dollars post-surgery while high on drugs like I've done before, I should not send anything to anyone that I don't want remembered for forever. I was fairly miserable the entire first week, understandably so. I don't do well on strong pain medication, but on top of all of that, I just couldn't sleep as well. Laying in bed, having ice packs on me, and constantly waking up cold and wet from the ice, it didn't help me relax. And so not only was I in pain and doped up on pain medication, I was exhausted. I felt like during that time I just existed to make it from one day to the next, and sleep was supposed to be a break from feeling everything, but instead of being a break, it was it was a frustrating experience. Eventually, my bruising began turning yellow and started to migrate down my face and my neck, and I was vastly fascinated with this. This is one of the neoprene sleeves that I wore. It was fantastic. It provided both compression and ice. Although the ice did not stay cold for very long, I ended up just buying multiples of them so I could continually have them refreezing while I was wearing one. I understand that you're supposed to do ice on it and ice off, but ultimately, I just wanted cold and compression on my swelling 24/7. As my face healed, I began to think the bruising looked like I had gotten in a fight. I was a bit bothered with my scars and how they poked out and a little self-conscious, but ultimately, I don't think anyone else cared, just me. I called this my ice bonnet, and I found it was the most effective way to deliver the coldest temperatures to my face. I realized it was probably dangerous to my skin, but I was willing to be a little bit reckless with my skin in order to have a numb face. So, come what may. For the first 5 days after my surgery, I had no desire to eat, which is unusual for me because I've always been considered a big eater. I primarily just drank coffee with half and half because I didn't want to go through caffeine withdrawals and peppermint tea. After 5 days, I started to get hungry, and the first things that I ate were scrambled eggs, soft potatoes, charro beans, queso, bananas, and peanut butter, and baby food. And in the end, that is primarily what I ate for the first month.
Thanks to my church friends, I also rediscovered an appreciation for casseroles, which are essentially a complete meal of meat, vegetables, and some carbohydrates cooked to a very soft, edible form for somebody who just had jaw surgery. Also, the Olive Garden lasagna and chicken and gnocchi soup were incredibly satisfying and easy to eat. Initially, it took me probably 4 days to eat an entire serving, but for the next few months, the order was made on repeat. I am not an emotional person, but on drugs, I am a very emotional person. And on day 16, I went to church, and so many sweet people asked me how I was doing. And every time they asked me, I burst into tears and essentially ended up weeping the entire time we were at church. Due to the swelling in my ear canal from the surgery, my ear canal at one point completely closed off and I couldn't hear out of it. But it also didn't allow any moisture to escape, so I ended up developing an ear infection, a swimmer's ear like kids get, and had to go to the doctor and get steroid drops for my ear. It was really just an icing on the entire painful cake. On day 17, a client contacted me asking if she could see me for an appointment the following day on day 18. I decided this was a good opportunity for me to dip my toe back into work, as I was supposed to start seeing 8 clients a day 4 days later. Therefore, that morning I skipped all of my strong pain meds and just took Tylenol and Advil for the remaining part of the day, and my husband drove me up there during the afternoon. The appointment was good. It was good that I saw her. However, for me, my brain felt slow and dumb, and it terrified me. And that was it for me. I did not take any more of the strong pain medication, sticking only to Advil and Tylenol. And it took probably 3 full days for it to clear out of my system. But once it did, that's when I really came to understand how much the strong pain medication affected my overall mood and outlook. And it was fantastic to stop it. As my swelling continued to go down and I gained more function of my face, I began to notice strange things happening with the skin around my eyes. I initially thought it was just because the skin had been stretched out or maybe the swelling had pulled down on it. But as I look back on this, I think it had more to do with the ocular muscles not working underneath my skin. So it was out of sync with my face when I smiled. However, the skin was so noticeable that even my 10-year-old son noticed it and asked me if it would go back because he was concerned.
I was diagnosed with Bell's palsy or facial paralysis, and although it affected the way that I moved many parts of my face, the way that I felt like it was most noticeable was with my eyes, because you need your ocular muscles to move your eyeballs. Therefore, I had strange eye movements where they would roll up and they would shift around. And although I couldn't see it because I was the speaker, I did know it was happening. And I was uncomfortable knowing that my eyes were doing something that I had no control over. But ultimately, I couldn't change it. And I knew that only time would hopefully would fix it. These progression photos were very valuable to me at that time. I studied my face to look for even the smallest improvements, and I would excitedly share them with my husband, and he was so sweet to celebrate it with me too. I slept in compression for about 3 months. Initially, it was to help with the swelling, but eventually I ended up wearing more of a chin strap. I think there's a photo of it later because my weak jaw muscles could not keep my mouth shut whenever I was sleeping, which resulted in drooling and snoring and dry mouth, all of the things that you don't want. And wearing the strap helped ensure that my mouth stayed shut until my jaw could regain its strength and hold itself closed while I slept. This was my first day back to spin class. I thought it would cause me to swell, but gratefully it did not, and it was really nice to be back there. I have been asked if I would do the surgery again, knowing everything that I know now, and I believe my answer is yes. Ultimately, because I now no longer have migraines, a lot of the muscle pain in my upper back and in my neck, and even the numbness in my fingers is gone. However, I do grieve the permanent nerve damage that I have, and I didn't realize how attached I was to being able to have facial movements, but it is a loss for sure, and I am actually still sad about that. And I think I always will be.
Tomorrow's 10 weeks since my bilateral or double jaw joint replacement surgery. I still have Bell's palsy. You can see that my eyes aren't blinking at the same speed, and you can see that they do a weird shifty thing as I'm going to blink. It's sometimes I don't think I'm doing it because it's involuntary, but then I see these little videos I make and it's really obvious that I am. I can move that eyebrow, just nothing right here. Here's my smile. See, it goes up higher over here. Still can't open my mouth a whole lot. I have a jaw stretcher, but I don't use it as much as I'm supposed to. Here's the scar on this side. It's a small little scar. And then you can't really see this one, but there's that.
I'm at 11 weeks since my double jaw joint replacement surgery. Not a lot of changes. Still can't move my eyebrow. Still can't really move the side of my mouth very well. But each week I'm able to eat more and more. I just ate a gordita and some chips and salsa. It was delicious. It was hard work, but I still did it. I've stopped taking Advil regularly. I noticed a bit of achiness in my jaw and maybe a slight increase in swelling, but I feel like the trade-off is worth it. Sleeping on my side, not using a chin strap,
Still can't move my face like I want, but I guess that'll come back when possible.
I began taking less photos of myself as I continue to heal, and you will notice more videos than photos.
I went and saw my surgeon last week. Here's this side, the scar he said looks really good. I might have to have a cartilage revision right here. This side is a mess. So here's this. My dissolvable stitches aren't dissolving, and on this side they've risen to the surface, so they cut it open and removed the dissolvable stitches, which I was fine with. That's what I wanted. And then they actually then had to stitch it back up with stitches that they said would fall out after 3 or 4 days.
So one more thing about my stitches. I was told to massage my scars and rub scar cream in it. It helps with proper scar formation. And over time, I began to feel like there was something under my skin. And I felt like a crazy person talking about something under their skin. But like I would feel like something hard underneath it, and I'd have my husband feel it. I'm like, do you see this? And he's like, I have no idea what you're talking about. And then one day it poked through like that, like a little piece of the stitch did. And I did not hesitate. As soon as I got home, I got my tweezers out and I pulled it out of my neck. And then I showed it to my husband. He was like, wow, that really was a stitch. And it was, I kid you not, like 1/4 of an inch to 1/2 inch long. And do you know what I did with it? I rinsed it off and I took a picture of it, and then I put it in a sandwich baggie like a crazy person. But then every single time it happened, because it happened on both sides and it happened with both ears. And every time it happened and I pulled it out, I would rinse it off and take a picture and put it in a baggie. Also on my ears, I felt like the wounds were not closing properly because the stitches were coming out. And so it felt like the wound was continually draining. Anyways, so finally, when I went to a post-op appointment, and guys, this is like months after my surgery, I told my doctor, I said, I've been pulling stitches out of my scars. And he stopped everything and he looked me right in the eye and he said, did you keep them? Did you bring them with you? And I was like, yes, I did keep them. And then I pulled my Ziploc sandwich baggie of my stitches out of my purse and I showed it to him. And he's like, this is so good that you brought this. And vindication. I had so much, like, I felt so vindicated and heard. And he said the depth of these stitches tell us where they're coming from. And he did say that these stitches were coming from like deep down, that should never come to the surface, and that I might not be very compatible with dissolvable stitches, but not crazy. I'm not crazy.
Tomorrow it's 16 weeks. It's 4 months, my smell. Here's my closed mouth smell. And here's my scars. Here's this one up here. Here's this scar. And here's this one up here. Tomorrow it's 4 months. There's this scar. Here's this one up here. That one's fine. And then here's this scar. And then here's up here. I can smile like this. And it looks pretty normal, but then I smile like this. And you can see I have facial weakness right here. And then here's how I can do my eyebrows. This one stays still, but I can scowl. See that? See a little movement? That's new. Here are my scars. And then you can't really see the ones right here very well. But yeah, that's how I'm doing. Obviously want to get the facial movement back because I bite this lip when I'm chewing sometimes, but I'm making progress on it. Just see, like, I can do that. And here's my smile. Here's my mouth opening. It's a little over 5 months.
As with many adults who've had jaw surgery and were required to wear braces for it, getting the braces off is a major milestone. And I was super excited to take as many full smiling photos as possible.
It's 6 months.
I went to physical therapy for months, and in this photo, you will see that there are needles stuck into my forehead, hooked up to a machine that's sending electrical currents from needle to needle, trying to stimulate the muscles. But ultimately, I've come to accept that I will probably never have full function or any function of that muscle. I am sad about it, but I guess you don't get to have as major of a surgery as this without having some sort of consequence.
8 months. Here's my scar on this side. Can't really see this one, it's just a crease now. Here's the scar on this side. Same thing as up there.
These are just some photos from over the last few months as I continue to recover. And then the last couple photos are close-up shots of my scars, and they are already in the turning to white phase, so I'm pretty pleased with them.
Thank you for watching. If this turns out to be helpful to others, I have considered making another video talking about how I got to the point of needing jaw joint replacement surgery and what that entire 3-year process looked like. Take care.